Good morning to you all. Good morning, class. Good morning to you all. Am I audible enough for you guys to pick what I'm saying? Am I audible enough? All right. Today we want to talk about the food preservatives and its adverse effects in our body system. Food preservatives and its adverse effect in our body system. Are we all online? Am I visible from wherever you are viewing the video from? Am I visible to you? Am I visible? All right. If I'm visible, I think we can go on with the topic we have today. We want to talk about the food preservatives and its adverse effects in our body system. And basically, what are food preservatives? What are food preservatives? These are chemical substances that are artificially made and being added to our food substances so as to prevent microbial contamination and also to add more value to the food by increasing the quality of the food. And basically, is to increase the half-life of that food substance. And if you look around very well, a lot of food items in which you consume, you are going to see one or two of these food preservatives being added, like the fruits, like the canned foods we normally take, our carbonated drinks, our vegetables, our canned products. Majority of these food products are being, they had what I call the food preservatives to them. They had food preservatives to them. So basically, we want to look at all of these food preservatives and their adverse effects to our body system. Because food is very, very important to us. And in so doing, we're trying to see that if we can put one or two things to increase the half-life of this food, we can sustain it by making it durable for long-time use and for long-time consumption. And importantly, majority of these food substances we are talking about are the vegetables, the carbohydrate food substances we take. And basically, these are food additives. They are being added to the food substances just to prevent the microbial growth and also restore to the food substance and increase shelf life, and increase shelf life, and increase shelf life, and increase shelf life. But these food substances has not come without a deleterious effect. It hasn't come without a deleterious effect. They tends to give us some deleterious effects, some harmful effects in our body system, basically. So let's talk about the classification. Basically, that's just the introduction of the food additives we have in our body system that can cause one or two harms to our body system, basically. So we want to talk about the major classification of these food items. And basically, these food items can be classified based on the based on the additives or food preservatives that are being added onto it. They can be classified based on their mechanism of action. Number one, we have what we call the antimicrobial food additives. or food preservatives. We also have antioxidant food preservatives. We also have anti-enzymatic food preservatives. Those are the major three classes in which the food preservatives has been classified for our use. And as I've said earlier on, they present us with one or two harmful effects. And they present us with these harmful effects. Some of them go to the extent of destroying our genetic information. They go to cause so many diseases in our body system. And this you are going to see as we go on through the course of this very lecture. So go on through the course of this very lecture, you're going to see. So the harmful effects range from headache, palpitation, and even cancer. Some of the adverse effects of these food preservatives ranges from palpitation, headache, cancer, and several diseases, and asthma and allergic reactions to our body system. So, as I've said earlier on, they have been classified into three major groups. They have been classified into three major groups. And what are these three major groups? We talked about the antimicrobial preservatives, antioxidant preservatives. We have the antimicrobial one. We have the antimicrobial preservatives. Two, we have anti-enzymatic preservatives. Three, we have the antioxidant preservatives. These are the major three classes in which these preservatives have been classified. These are the three major classes in which they have been classified. Basically, antimicrobial preservatives, anti-enzymatic preservatives, antioxidant preservatives, right? So the antimicrobial preservatives, basically, they tend to delay and destroy the process of microbial growth. They tend to delay and prevent the growth of microbial growth. Anti-enzymatics, these are the food additives or food preservative substances that inhibit the enzymatic reaction that causes some food substances to be ripened or turned into a different color away from the normal color of the food substance. So they also participate in increasing the half-life of these food substances. We want to talk about the antioxidant preservatives. The antioxidant preservatives basically are the food preservatives agent we use to prevent the oxidational process that do take place in food substances. So this is one of the food preservative substances that we normally use in food industry to actually make the food durable for eating, increase the quality of the food, prevent microbial contamination, and also increase the half-life, prolong the half-life of these food substances. And this is what the food preservative substances or chemical agents are actually doing in our body system or generally. And we have said that these food substances do come with one or two adverse effects. As we are taking them, researchers have proved that they also have one or two deleterious effects to our body system, such as cancer, such as disease, such as hypersensitivity reactions, such as asthma. Name them, numerous of different diseases can be caused by these food preservatives. And the majority of the researches that are going on now, the mounting evidence is pointing towards using natural preservatives just to minimize or totally prevent the adverse effects of these food preservatives. All right. So let's talk about the antimicrobial preservatives. Antimicrobial preservatives. Antimicrobial preservatives, they are more of preservatives that delay, as I rightly said earlier on, delay and destroy the growth of bacteria, yeast, and mold. They delay the growth of, they cause a delay or prevent the growth of bacteria, mold, fungi. They prevent their growth in our body system. And under this class, we have the group nitrites. 2, we have nitrates. 3, we have benzoids. And 4, we have what we call the sulfur dioxide. These are the type of food preservative we have under antimicrobial food additives. It's just, we have the nitrites, we have the nitrates, we have the benzoids. We also have the sulfur dioxide. It tends to inhibit the growth of bacteria, molds, and fungi in our body system. And by so doing, they can increase the half-life of that food substance. They can increase the half-life of that food substance. They can promote the quality, increase quality of this food substance, and also they prevent bacterial contamination that can lead to fermentation and decomposition of that food substance. Those are the very importance of this very food preservative we have under antimicrobial preservatives. All right, so we want to move to other class of food preservative. We want to move to other class of food preservative. We want to talk about the antioxidant food preservative. What are the antioxidant food preservatives? The antioxidant food preservatives are basically food preservatives that tends to limit or decrease the rate of oxidation in food substances. The rate of oxidation. They inhibit peroxidative process. And this peroxidative process are the process that naturally destroy the fat and oil you have in food, leading to fermentation and decomposition of that food substances. By way of addition of these antioxidant preservatives to the food substance, it increases the half-life of that food substance. It maintains its quality, and as well, it brings about more duration for the food to be used. Under this antioxidant food preservatives, under this antioxidant, we have butylated hydroxyl anisole. We also have butylated hydroxyl toluene. We have propyl gallate. Those are the antioxidant food preservatives we have that can actually inhibit lipid peroxidation in our body system. In the food substance, they inhibit the peroxidative process that could actually take place in the food substance. We said they include butylated hydroxyl anisole. We have butylated hydroxyl toluene. We also have propyl galates. All of these are antioxidant. They prevent antioxidation. And that is one of the reasons they are called antioxidants. They prevent oxidative process, which leads to fats, decomposition and peroxidation. So by way of the ability to prevent this oxidative process, they tend to potentiate the shelf life of food substances. And we're going to see some of the adverse effects of these food substances in our body system. That's why they are doing very good thing to increase the half-life of food substances. They are at the same time causing some deleterious effects, which has been proven by scientific work, basically. So let's move to enzymatic. We want to go to the third class of, and also in antioxidant, we have the tocopherol. Before we move to anti-enzymatic, we have tocopherol. Tocopherol, ascorbic acid, major content of your vitamin C. As also when any substance food you are taking or you see, you'll find out that all of these preservatives are written on the container of the food substance. And whenever you see them on the container of this food container, you understand? Whenever you see them on the food container, it's just pointing to the fact that they are functioning as an additive to present and to preserve, to present to that food a long half-life and preserve the food so that it doesn't get destroyed or spoiled as quickly as possible. So those are the major functions of these very food additives, basically. So we want to talk about the third class. We want to talk about the third class of food preservatives, which are described as the anti-enzymatic food preservatives, anti-enzymatic food preservatives. They include 1, citric acid. Number 2, erythrobic acid is found in sugar, precisely. The citric acid, erythrobic acid are food additives that are classified under anti-enzymatic food preservatives. And from the word anti-enzymatic, we can quickly guess their major function. What they do basically is to prevent the ripening occurring in foodstuffs. They prevent this ripening that normally occur in foodstuffs. So, by them preventing this very food substance from being destroyed, they kind of increase the half-life of this food. They maintain the quality. They maintain the quality of the food. All right, as like so my students are saying I should recap and go back, because it's as if they perceive that I'm a bit fast about teaching. I think probably we need to rush this over again. Let's quickly rush through this over again. What we have said earlier on is that we have 3 major classes of food preservatives. Number 1, we said one class is antioxidant food preservatives. We also have what we call antibacterial food preservative. And we also have anti-enzymatic food preservatives. Those are the major classes of food preservatives we have in the body system, basically. Those are the major classes of food preservatives we have in the body system. So let's go over the antimicrobial antimicrobial food preservatives. The antimicrobial food preservatives, they basically inhibit or reduce the growth of bacteria in our food substances. They basically inhibit the growth of bacteria, molds, and fungi in our food substances. And that is one of the reasons they are added. And belonging to this class, we have the nitrites, we have the nitrates, we have the benzoic, we have the fourth one, we have the nitrite, we have the nitrate, we have the benzoic acid. We also have sulfur dioxide or sulfur dioxide under that group, right? So let's go on. Sulfur dioxide, all right. So on the antioxidant and on the antioxidant preservative, we have what we call butylated hydroxytoluene. We also have butylated hydroxyanisole. We have propyl gallate under antioxidant. Somebody said you shouldn't get that very pronunciation or what I just said. I think I need to repeat that again. So under antioxidant food preservatives, under antioxidant food preservative, we have what? We have butylated hydroxyanisole. We have butylated hydroxytoluene. We have propyl gallate. These are the third measure of antioxidant food additives we have under antioxidant food additives. That the major compound, butylated hydroxytoluene, butylated hydroxyanisole, and propyl gallate. They help to prevent the breaking down of fats and oils you have in food substance. And also, they inhibit lipid peroxidation of fatty foods. So when you get your food from stores, when you get your food substance from Walmart and you see all of this, your mind should go straight quickly to what they are actually doing as a function, right? So under anti-enzyme, we said we have citric acid and erythropic acid. These are the major classes of the food preservatives we have in our bodies, in food substance that we take in our body, basically. So let's go to importance of food preservatives. Importance of food preservatives. Importance of food preservatives. How relevant these food preservatives are to our food substance that we take into our body. Number one of the major importance of food preservatives is to increase the shelf life of food substances. They increase the shelf life of our food substances. And what do we mean by increasing the shelf life of food substances? If the food is supposed to get spoiled within 3 days after opening it or after interfering with it, by way of addition of food additives or preservative substances, the life of this food substance can be increased. It can be elevated, making it to be more than the normal days in which the food is supposed to spend. All right? So those are the importance. And also is that it maintains the quality of food substances. It maintains the quality of food substances. It maintains the quality. And also, thirdly, food preservative substance arrest fermentation process. The arrest fermentation process in our body system, they do arrest fermentation process. They arrest. All right, I'm too fast, okay. All right, no problem. I think I will kind of take it a bit calm because of my students. They're saying it's like I'm too fast and they're not getting some of the technical terms well. All right. From where we said importance. Number one, we said they increase the shelf life or the half-life of that food substance. Number two is that they tend to increase the quality. They maintain that quality. So there's times you take food substance after some time of, like you put your margarine inside, you put it on your table after you've opened it to use it for, whatever way, whatever thing you're using it to consume. And after a time, you now discover that you want to use this margarine and it's getting sour. It's getting sour. This is just to tell you basically that the food substance has started the process of fermentation. That's just telling you the food substance has started the process of fermentation. And that is one of the reasons we had vitamin E as an antioxidant, so that it will reduce the oxidative process and prevent it from happening in your margarine. Margarine is a fatty substance, and the expected reaction to take place there is peroxidation, where oxygen mixes with some of the chemical structure and compounds of that margarine, and at the end of the day, it turns it into being sour. But with the addition of this food preservative, the antioxidant, such as butylated hydroxyanisole, butylated hydroxytoluene, and propyl gallate, they will reduce or totally eradicate the process of lipid peroxidation, so as to increase the half-life of this very food substance. Right, let's go back to the importance where we were talking about the importance. Then arrest fermentation. Another importance of food preservatives is that they reduce acidification process. They prevent acidification, and they also prevent microbial contamination and decomposition of this food substance. There's some bacteria that cannot survive in the presence of some food additives. They cannot survive because those food additives will interfere with their biological process. And by so doing, the bacteria will be destroyed. Another classification of the food preservatives we'd like to talk about is some classification tends to classify the food additives into class 1, class 2, class 3. Class 1, class 2, class 3. The class 1 basically comprises of the salt, sugar, honey, and vinegar. These are the whole preservative substance that has been used on before civilization and in the ages, stone ages. They are the kind of food preservatives that have been used during those time of, the ancient time. Sugar, salt, and vinegar. And some people are still in the process of using them as well. So that's class 1, salt, sugar, vinegar. All of these are classified as class 1. They're classified as class 1 preservatives. Class 2 basically includes sorbates, benzoic, sulfites, nitrates, glutamate, and glycerides. That's class 2. And class 3, this is the combination of class 1 and class 2. 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 Combination of class 1, combination of class 1 and class 2. All right. So let's move on with our discussion. So basically, majority of this food preservative substance tends to work on different mechanism of action. They work on different mechanism of action, Like for instance, under antioxidant, we have ascorbic acid. Ascorbic acid has been known to be oxygen scavenger. Ascorbic acid has been known to be oxygen scavenger. For instance, also butylated hydroxy anisole butylated hydroxytoluene. This has been identified to work via free radical scavenging. They work via the mechanism of free radical scavenging. They work through free radical scavenging. Like sulfite, for instance, sulfite works as inhibitor of enzyme inhibitor. Sulfite works on the inhibitor of enzymes. While acetic acid, benzoic acid, and nitrates, propylenic acid, sorbic acid, they tend to inhibit the membrane function of the bacteria. They inhibit the membrane functional structure of the bacteria. So by so doing, they destroy that bacteria because the bacteria needs the membrane as a protective shell to have itself the normal functioning. And once this membrane is destroyed, definitely the bacteria tends to undergo death. So those are basic mechanisms, and this you're going to see in the slides after the lecture when I'm going to send the slides to your class rep later. You're going to see it in my slides all of the mechanism of action of this food preservatives, basically. You're going to see that. All right. So let's move to each of this food preservatives with their adverse effects. And what do I mean by adverse effect? When I say adverse effect, we're talking about the food preservative basically being associated with a harm, as they are being used to preserve the life of a food system. They are also causing some level of harm to the body system during consumption. So we want to talk of benzoic acid. Adverse effects of food preservatives. Adverse effect of food preservatives. Basically. Adverse effect of food preservatives. Number one, benzoic acid is what you normally see majorly in our carbonated drinks, the drinks we normally take. Most of the time, we see these carbonated drinks. We see inside these carbonated drinks benzoic acid. And don't forget, benzoic acid belongs to the class of antimicrobial food preservatives. So we have it in more of our drinks, margarine, fruits, and some pharmaceutical products. The major adverse effects that has been identified with high consumption of benzoic acid is one, hypersensitivity reaction. Number two is that the cause they have been associated with asthma. Number three, they are associated with genotoxicity. These are the main three effects adverse effect that has been associated with benzoic acid as a food preservative. Hypersensitivity reaction, hypersensitivity reaction, you've done your immunological topic. You have type 1, type 2, type 3, type 4. So because this substance, the body perceives it as foreign to the body system, they can actually initiate hypersensitivity reaction by stimulating the immunoglobulins, And if you remember very well from your normal immunological reaction that I had with you, hypersensitivity reaction has got to be associated with immunoglobulin E, IgE, basically. So they tend to potentiate and activate the IgE, bringing about hypersensitivity reaction. And also very important is that they can potentiate asthmatic attack. They can potentiate asthmatic attack. And what is asthma? That is inflammation, chronic inflammation of the airway, the breathing apparatus, which can eventually lead to difficulty in breathing and some other clinical symptoms. Another important adverse effect of benzoic acid is that they mediate what we call genotoxicity. They cause toxicity of the genes. They dysregulate the gene expression. They bring about dysregulation of the gene. And by so doing, this can consequently lead to cancer, tumor cell growth, knowing fully well that our gene regulates replication and differentiation of cells. And by so doing, they can affect the expression of gene, leading to mutation, which can lead to cancerous cells development. All right. We want to talk about the sorbic acid. We want to talk about the sorbic acid. We want to talk about the sorbic acid. Yes, class 2 includes sulfate, nitrate, and benzoates. Yes, class 2, it comprises of sulfides, nitrates, benzoates. While class 3 is the combination of 1 and 2. Class 3 is a combination of 1 and 2, basically. All right. So, well, we want to talk about another food preservative with its adverse effect in our body system. We want to talk about sorbic acid. Sorbic acid has been a food preservative in the food industry, and it has been shown when it is being taken in huge consumption in our body system to cause contact dermatitis. Sorbic. When I talk about sorbic, it has been associated to cause contact dermatitis. Two causes genotoxicity, and 3 urticaria. Contact dermatitis is more of an inflammation process of the disease of the skin. Urticaria is an allergy. Genotoxicity, which I've explained earlier on, that is toxic effect on the gene. The toxic effect on the DNA, deoxyribonucleic acid. The toxic effect on the DNA. And you know your DNA maintain your gene expression. And once this is altered, definitely abnormal gene synthesis or gene expression of protein takes place. Abnormal protein, not the normal functional protein, will be expressed, right? Not the normal protein will be expressed. All right, so let's talk about another food preservative. Another food preservative. Another food preservative we want to talk about is hydrogen peroxide. Hydrogen peroxide has been associated with more of medical practice because it inhibits the growth of microorganisms. It be the growth of microorganisms. And sometimes it has also been employed in poultry food substances, and some seafoods is being preserved with the use of hydrogen peroxide. The major deleterious effect of hydrogen peroxide is its ability to be carcinogenic, via ability to stimulate the free radicals and lipid peroxidation process. And this produces hydrogen peroxide radicals. And these hydrogen peroxide radicals are very dangerous to the body system because they will cause damage to the gene. They will cause damage to the lipids. And at the end of the day, this can lead to cancer cell growth, in the body system. So let's move to another important preservative. In this group, we have the nitrates, nitrites, and nitrous amines. The nitrate, the nitrite, and the nitrous amines. The nitrates, nitrites, and the nitrous amines. This is a very common food preservative we normally see in the preservation of meat substance, dietary meat. Use it in preservation of dietary meat. And basically, the nitrates get converted into nitrites after consumption. They get converted into nitrites. And sometimes these nitrites can bind with the oxygen-carrying protein, hemoglobin. And once they bind the nitrite substance, they bind with hemoglobin. So hemoglobin plus nitrate substance will produce what we call metamoglobin. And this will prevent oxygen tissue perfusion. This will prevent the oxygen tissue perfusion. And as a result of this, you now have less oxygen at the tissue. This can predispose patient to the case of blue baby syndrome, because of the lack of oxygen. Because the oxygen carrying protein has been interfered with. And because of this, it can lead to this very disorder called blue baby syndrome. It can lead to blue baby syndrome. Very important. Let's talk about the major symptoms you tend to see in people who consume the substance. In high dosage or high doses, and as a result of this, they present with symptoms such as 1, nitrite has been associated, nitrate compounds with nitrosamine, to cause high UGR, intrauterine growth retardation. This is a condition in which a pregnant woman that consumes food substance that is in high dose of nitrite, they will bring about intrauterine growth retardation. That talks about the growth of the fetus will be interfered with. There will be retarding of the growth of the fetus. It can also lead to number 2, it can lead to cancer of the brain and cancer of the blood cells, the white blood cells, the cancer of the brain, the cancer of the white blood cell, leading to what we call leukemia. Leukemia is a cancer of the white blood cell. And also, it can lead to what we call increased incidence of sudden infant death. Sudden infant death syndrome, increased incidence of sudden infant death syndrome. So this talks about a pregnant woman that gave birth, and during the course of gestation, she has consumed so much of nitrate containing food substance. So after the birth of the baby, it can lead to what we call increased sudden infant death syndrome. It has also been associated, the nitrate has been associated with childhood diabetes. And also Parkinson disease. You know what? This is juvenile type 1 diabetes mellitus. Juvenile, that's type 1 diabetes mellitus. Parkinson's disease, you know what? It's Parkinson's disease. Parkinson's disease is a neurodegenerative disorder of the basal ganglia of the brain, part of the brain. And as a result of this, it tends to bring about neurodegeneration of dopaminergic fibers, which are meant to synthesize and release dopamine. And due to loss of these neurons, you now have decreased production of dopamine. And such patients present with movement disability. They present with movement disability. They present sometimes with dementia. They present with gaits that are not stable. So that is all about Parkinson's disease. Another important problem you can see with high dosage consumption of nitrates or nitrite is that they can also lead to respiratory tract infection, and also is that they can cause also gastric cancer. Nitrates, nitrosamines binds to the protein of the GIT, thereby leading to leading to cancers, or the cancer of the stomach, gastric cancer, stomach cancer, basically. So we want to move to another food preservative that we normally use in food industry. Another food preservative that is normally being used in food industry, furfuramide. That's AF2 acrylamide. This is another very important food additives or food preservative that is being used in food industry. And the adverse effect of this is that it causes breast cancer. Two, it causes lung cancer. Three, it can also cause stomach cancer. Can lead to stomach cancer. Breast, lung, and stomach cancer has been identified or associated with furfuramide, and they can also cause, some other irritation like hypersensitivity reaction. So let's talk about another food preservative. We want to talk about sulfites. It's another food preservative that you often see in beverages and wine. When you're taking your wine, try to look under the information that is always being displayed at the bottom part of your wine. Sulfide is one of the food preservative substance that is being used, and sulfide has been associated to cause asthma and bronchospasm. Asthma and bronchospasm. We have talked about asthma as an inflammatory disease condition of the respiratory organ, whereby it leads to difficulty in breathing due to the inflammation of the airways. And we talk about bronchospasm. Bronchospasm talks about the increase in contraction of the bronchial smooth muscle. And as a result of this increased contraction, it tends to narrow the airway, so much oxygen that is needed cannot pass through, gain entrance into the tissue. And this is dangerous. And basically, it is due to the deficiency of sulfite oxidase enzyme. So we briefly want to talk about the mechanism of action of excitotoxic effects. Mechanism of action of excitotoxic effect. Mechanism of action of excitotoxic effect. Number one, mechanism of action of excitotoxic effect. We have one, dysregulation of gene expression. Dysregulation of gene expression. Number two, dysregulation of signal transduction. Number three, dysregulation of ongoing biological cellular process. So these are the way in which this toxic substance tends to affect our body, causing those carcinogenic effects, causing some signal transduction alteration, and affecting the ongoing cellular process in our body system. So these are the major ways they cause gene expression dysregulation. They also cause dysregulation of signal transduction, and they also cause dysregulation of ongoing biological process in our body system, basically. So the next we want to talk about is toxic alteration of cellular maintenance. 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 Toxic alteration of cellular maintenance.